action.
Morning class, my name is Harry Lee. I'm an SPT. I'm here with my patient, Mr. Yates. He's here today because he has some tingling going down his right arm down to his right hand. I'm going to be doing an upper quarter screen to rule in or rule out if it's a neurological issue. First, I'm just going to assess your static posture. Sit how you normally would. I'm going to assess it in all different planes to see if there's any lateral shifts or any scoliosis. I think it looks good. So I'm going to be applying some overpressures to see if that can recreate any symptoms. So the first one I want you to do, I want you to bring your head down, to your chin down to your chest. Any symptoms with that? I'm going to apply some overpressure. Is it better, same, or the worse? All right, so now I want you to bring your chin up to the sky. How's that? Okay. Better, worse, or the same? All right, so now I want you to look to your left. Better, worse, or the same? Okay. Apply overpressure. Better, worse, or the same? All right, the other side. Better, worse, or the same? And so now I want you to try to bring your left ear to your left shoulder. Better, worse, or the same? All right, other side. Better, worse, or the same? All right. Bring your shoulders back and kind of doing a double chin, and we're just trying to recreate any symptoms here. All right, next, I want you to bring your shoulders forward and stick your neck forward. Does that recreate any symptoms? Okay, so now we're gonna do some AROM and overpressures. So first, with your left arm, just want you to bring it up. With your left arm, sorry. Bring it up. Is there any symptoms with that? Better, worse, or the same? Same. Okay, now I'm gonna apply some overpressure. Better, worse, or the same? All right, ready to go to this one. I'm gonna do the same thing. Bring it up. Better, worse, or the same? Same. Okay, overpressure. Better, worse, or the same? Same. Okay, so next, I want you to bring your left arm at a 45-degree angle. Your left arm.
Left arm.
All right, is there any pain with that? How about that? All right, now with your right arm. Better, worse, or the same? Better, worse, or the same? All right, so next I want you to bring your arms behind your back and interlock your hands. Better, worse, or the same? Better, worse, or the same? All right, now I want you to bring your arms behind your back like you're getting arrested. How's that? How's that? Okay, so next, with your left arm, I want you to act like you're doing your left arm. I want you to do a bicep curl. How's that? Okay, I'm gonna apply some overpressure. Better, worse, or the same? I'm gonna do the same on this side. How's that? Better, worse, or the same? Alright, so next with your left arm, I want you to extend it. Try to bring your elbow to the ceiling. I'm gonna apply some overpressure. How's that? Okay, so this side. How's that? Okay, so now with your left hand, I want you to have your palms up. You're gonna flex your wrist. How's that? Extend your wrist. I'm gonna apply some overpressure. Better, worse, or the same? Okay, this side. Better, worse, or the same? Okay, so now we're gonna go down. Better, worse, or the same? Okay, this side. Better, worse, or the same? Okay, so now for this, just want you to have your finger out. Try to flex your finger. Apply some overpressure. Better, worse, or the same? Okay, same with this side. Flex your finger. Better, worse, or the same? Now I want you to try to point your finger up. Better, worse, or the same? Same thing. Better, worse, or the same? Alright, so now we're going to be doing a dermatome test because the nerves are responsible for three things: sensation, muscles, and tendons. And so with the dermatome test, we're gonna see if there's any altered sensation on the affected side. All right, sir, so I just want you to have your eyes closed for me. So we're gonna start off with C4. Does this feel the same as this? C5, does this feel the same as this? Yeah. C6, does this feel the same as this? Yeah. C7, does this feel the same as this? Yeah. C8, does this feel the same as this? Yeah. And T1, does this feel the same as this?
Alright, so I did the myotome test with Mr. Yates earlier, but however the footage got deleted. So now I have a new patient. Her name is Miss Bullard, and I'm going to perform the myotome test on her. So with the myotome test, if it is a suspected nerve-related issue, a group of muscles will appear weak or easily fatigable. So we're here to see if any of the spinal levels associate with any weakness. Alright, so first start with C4. Can you bring your shoulders up to your ears? Alright, and don't let me move you. I'm gonna hold this for 5 seconds. And that was C4. So now we're gonna go C5. Can you bring your left arm out like this? And don't let me move you. Alright, other side. Remember, always do the unaffected side first. Alright, now we're gonna go C6. With your left arm, can you do a bicep curl? Alright, and don't let me extend your arm. Ready? 1, 2, 3, 4, 5. Alright, now this arm. Do a curl, yep. 1, 2, 3, 4, 5. Alright, so for C6, it also does wrist extension. So I want you to have your palms up. And don't let me move you. 1, 2, 3, 4, 5. Alright, this side. 1, 2, 3, 4, 5. Alright, now we're going to do C7 with your left arm. Can you just hold it up like this again? Alright, you're going to want to extend. I'm going to push you. Don't let me move you. Ready? 1, 2, 3, 4, 5. Alright, this side. 1, 2, 3, 4, 5. Alright, so another one for C7 is wrist flexion. So I want you to have your palm down, your left palm down. Yep. And then I'm going to pull you, don't let me move you. Ready? 1, 2, 3, 4, 5. Alright, this side. 1, 2, 3, 4, 5. Alright, now we're going to do C8, which is finger flexion. So with your left arm, with your left hand, we're going to have it like this with your palms facing the floor. I'm going to try to extend your fingers and don't let me move you. Ready? 1, 2, 3, 4, 5. Alright, this side. 1, 2, 3, 4, 5. And another one for C8 is thumb abduction. So I just want you to have your hand out like this. I'm going to try to push your thumb towards your fingers. Don't let me move you. Ready? 1, 2, 3, 4, 5. Alright, this side. 1, 2, 3, 4, 5. And then lastly, we have T1, which is responsible for finger AB and adduction. Alright, so I just want you to have your hand out like this. I'm going to try to separate your first finger. Don't let me move it. Ready? 1, 2, 3, 4, 5. Alright, this side. 1, 2, 3, 4, 5. And then for finger abduction, we can do it on the pinky. Don't let me move you. Push your pinky in. 1, 2, 3, 4, 5. Alright. 1, 2, 3, 4, 5. Alright, that's the myotone test.
Alright, so now we're going to be doing a DTR test, deep tendon reflex, to determine if it's a lower motor neuron issue, and if so, it would be hyporeflexive. So first we're going to start off with C5. Just want me to hold this there, and I want you to resist me so I could find the tendon. Alright? I just want you to relax your arm now on your leg, and can you look that way? Okay. We're just same on this side. Alright, resist, thank you. Alright, I'm just gonna look that way. All right, now we're gonna go to C6. I'm gonna have your wrist. Can you flex your hand for me, or your arm? All right, you can relax. All right, I just want you to look that way. Okay, same on this side. Can you look that way for me? All right, so now we're gonna do C7. You bring your arm, and I just want you to relax. Find the tendon. All right, on this side. Just want you to relax for me. Okay. All right, so lastly, we're gonna be doing a special test called the Hoffman to rule out if it's an upper motor neuron issue. So what you would do is you would grab their hand, stabilize it, and then what we're looking for, a positive test would be his thumb curling into his index finger. So you're gonna grab the nail and flick it. And same for this side.